So much. Well, as that hot weather sits in, avoid going out in the heat of the day.
That's right, and stay hydrated. Those are the little nuggets we've heard about to avoid a heat stroke. But for parents, the question is, can your kids have a heat stroke too? Action 3 News reporter Deborah Tuff has the answer to that question. She joins us now live from Children's Hospital with Dr. Robert Spicer. Deb.
That's right, guys. Dr. Spicer is a well-known cardiologist. He also sits on the board for the American Heart Association here in Omaha. Dr. Spicer, thank you so much for joining us this morning, and good morning to you.
Good morning to you. Thanks for coming.
Yeah, no problem, no problem. So the first question, can a child have a heat stroke?
I'm sorry to say that yes, they can.
Wow.
It is uncommon, but yes, they are at risk of heat stroke for the same reason that adults are at risk, especially in weather like this.
Jeez, now what are some symptoms parents should look out for? Because a lot of kids are going to want to play outside this weekend.
Yeah, I think that it behooves parents and older brothers and older sisters to pay attention to the kids when they are outside, and if they seem to be acting different, if they're complaining of headaches, if they're vomiting, if they just are listless, you should pay attention to that child and make sure that you get them out of the heat and take care of them.
Now, when we were talking earlier, we talked about some kids may be at higher risk than others. Who are those kids that may be at higher risk to have a heat stroke?
Kids who are on medications, and the kinds of medications especially are those that would control blood pressure, things that would control heart rate. Kids with chronic medical conditions are especially at risk.
So children can have heat strokes too. Wow, that's interesting. What about adults? What symptoms should adults look out for? Is it pretty much the same thing?
For you and for me, it's similar, but we need to pay attention to ourselves. And I think things like headaches, changes in your vision, feeling sick to your stomach, a sensation that your heart is pounding, feeling that your heart is pounding in your neck or in your tummy, nausea, vomiting, just feeling blah.
Yeah. All great information. Thank you so much, Dr. Spicer. Dr. Robert Spicer, head of cardiology, here at Children's Hospital, sits on the board for the American Heart Association. This guy knows his stuff. If you would like more information about heat stroke safety, just head to our website, KMTV.com. Live from Children's Hospital, Deborah Tuff for Action 3 this morning.
All right, Deb, thanks.